More than 1 million neonatal deaths per year in sub-Saharan Africa. This is the World Health Organization estimate. What is clear is that there's a knowledge gap in data, fundamental to lower the infant mortality rate in Africa. That's the Impulse Project framework.
In this framework, data are essential for monitoring and planning. So the goal of the Impulse Project is contributing in decreasing the number of stillbirths and in improving neonatal mortality and morbidity by working on data and improving data quality and data use. We are working at different levels of the health system, from facility to district, regional, and Ministry of Health, and we are including both the private and the public sector.
We do that by working at 4 countries: Ethiopia, Central African Republic, Tanzania, and Uganda.
The Impulse Project can help in informing policymakers on where there is a gap and where there is a need for improvement. For example, in the current situation, there is a gap, especially in the neonatal deaths. It seems that it's a worldwide situation. Through the Impulse Project will help policymakers and decision makers to take action on ways to improve newborn health in our context and in other countries.
The Impulse study is about people, the people who've come together to implement this project together. And that includes academic partners and QAM Doctors with Africa. The academic partners include the London School of Hygiene and Tropical Medicine, which is where I work, working alongside Ifakara Health Institute in Tanzania, Makerere School of Public Health in Uganda, and the WHO Collaborating Centre in Berlo, Italy. We're grateful to the Chiesi Foundation for funding this project. Impulse is about the people for whom we're trying to improve the data, and that includes the newborns, their parents and families, but also the midwives, nurses and doctors using that data for clinical decisions, as well as the managers and policymakers using the data for decision-making to improve health systems.
Our role, of course, is to engage, work with the policymakers to be able to showcase the results from the research, but also to be able to transform the challenges based, of course, on the evidence that we've gotten from the research.
What we do is we're always focusing on giving care and providing the service. But then when it comes to collecting the data, it's something that we think of after we finish our duties. But when you think about it, let's say in one facility, if there's no way to know if there's high newborn mortality or if the service that we are giving is actually making a difference in preventing stillbirths or neonatal deaths, unless we have the data. So that's the really forgotten part of things. Let's say if resuscitation that was being done at labor ward was not really making a difference, or if it's not really being done, how do we know? We have to see the data. So we have to merge those two things to decide the interventions we're giving clinically, not just to make policies or to make programmatic decisions, but also to make clinical decisions.
The first phase of the Impulse project aims at assessing newborn and stillbirth key indicators of data quality in 150 sites over the 4 selected countries using the mini tools. The results, key strengths and key gaps will be shared with national stakeholders and authorities. The second phase of the Impulse project will be a co-creation and implementation of practical and sustainable interventions to improve routine newborn and stillbirth data quality and use.
Le lien qu'on peut faire entre la recherche en santé et les interventions cliniques est que ces résultats issus de ces recherches vont permettre aux cliniciens d'apporter des interventions appropriées. C'est pourquoi il est important pour tout projet en santé de passer d'abord par les recherches. Et ces résultats vont permettre d'améliorer une prise en charge adéquate de tout système de santé.